Hi guys, it's been a while since the last time I made a video, but I just pretty much want to keep you guys updated and at what's going on in my life. Actually, a lot has happened since I made the last video where I was giving you guys tips as to how I prepared for the NCLEX. After I was given the good news that I officially passed, I was already scheduled for an interview for this one program. It was a fellowship, or it's a fellowship for an emergency department. Many of you guys should really look into fellowships. They're great opportunities for the hospital to train you guys in a period of time, depending on what the hospital requires. And they're usually for critical care areas. In my case, if it's the emergency department, many hospitals offer critical care like CCU, CTU, all these critical base units that usually require at least a year of experience before even getting a job. So these hospitals are offering this great opportunity where they will train you for that period of time and get paid for it, and then you are given that position. But they're very competitive. They require a lot of studying time. It's just like nursing school, but it's great, right? Who wouldn't want to start working or start their nursing career at the emergency department and with training? But anyways, I was interviewed for that, and I actually did two interviews. And 2 weeks later, I found out that I passed, or sorry, that I found out that I got the job. So that was great, exciting news. I've actually been working there for almost, this will be my 4th week there. So time flies. I'm making this video so that you guys don't get discouraged. Look, I failed the exam the first time, and after I passed, I got a job within 2 weeks. So definitely, please do not feel discouraged. There's many jobs out there. If you guys like, or I definitely will be making a video as to tips of how to answer interview questions, because I feel like that really sealed the deal when it came to this interview for my fellowship. One thing I did learn as I was practicing for this interview was hospital is a business, right? The same way you guys go to a restaurant and you guys want the great customer service, works the same way in a hospital. So they even told me, look, we can train you to put in IVs, we can train you to perform CPR, we can train you to understand an EKG, but we can't train you to give great customer service. That has to come within you. So a lot of hospitals are looking for people that are just approachable, friendly, and you have to give that vibe when it comes to the interview. And it's very scary. They ask you common questions like, tell me a little bit about yourself, and give me one time where you encounter a very difficult decision and explain how you overcame that. And then they give you behavioral questions like, give me a scenario where you gave great customer service, or gave me a scenario where in clinical you did more than you were supposed to. So questions like this are given to you, and right after another, and usually with these interviews there's more than one person. So it can be intimidating, but it's doable. I did it, and I'm still shocked that I got it. And right now, it's been a lot of lectures, orientation, just knowing a little bit about the hospital, knowing their policies, because it's completely different than nursing school. They really teach you by what the hospital wants you to do, right? And within a month or two, I'll start going on the floor. I'm actually going to start going to the floor very soon, but I really will come back and give you really on-site. I'll give you more detailed experiences and stories, and of how I'm overcoming these obstacles, because I know many people that are also starting their career, and it's a struggle. And there are some times now where I question, like, can I do this? Will I be able to do this? But I know we will be. We're just feeling insecure because we don't have any experience. but we eventually will get there. And there's so many people out there that will help you. And yeah, so hopefully everything's going great to all of you guys. Like I said, if you feel like, you know, passing the NCLEX has been an obstacle, um, feel free. I'll try to help you as much as I can. Um, just keep in mind that a lot of people do go through this, so do not feel like you're the only one that's going through this obstacle. Wish you the best.